Right, let's keep you updated on the international situation. We'll go to Germany now, where our correspondent DW has the latest updates. Emmanuel Shays is the political correspondent. Emmanuel, how is the situation in Germany right now?
Well, the number of cases of coronavirus positive cases has risen again, has increased today. We're currently at 31,500 plus cases and unfortunately 150 deaths today. So the pandemic continues. So far, the hospitals in Germany say that they are not being overwhelmed. There are still beds available for critically ill patients, so much so that Germany actually offered to take on some of the patients from worst affected areas. Some patients from Italy came to hospitals in Saxony and in Bavaria, while German regions neighboring France actually took on some critically ill patients from the eastern part of France, which is the worst affected part. So the pandemic continues on here in Germany, where more measures have been taken for people to stay away from one another. Now, since this weekend, it's no longer possible for people to meet up between more than two people, and even then they have to keep their distances, at least 1.5 meter between each person, and they are urged not to go out unless it is necessary to do their grocery shopping, to go to the doctor, or to go to work for those of the Germans who can't work from home.
Give us an update on Angela Merkel. Have there been some new confinement measures adopted for her?
Well, the Chancellor is currently working in quarantine from the safety of her home. She was in touch last Friday with a doctor who administered her a precautionary vaccine, a pneumococcal vaccine, and since then this doctor has been tested positive for COVID-19. The Chancellor immediately went into quarantine. So far she has been tested negative, but out of precaution she's staying in quarantine at home and working from home.
Give us an idea of life in Berlin right now following this outbreak. How have things changed for the average Berliner?
Well, life has totally changed, has entirely changed. Within a few days, a few weeks, you no longer see people in the streets, or very little people in the streets. You see very few cars in the streets. Everything is very, very quiet, eerily quiet. When you go to the shops, you see people being quite stressed out. There are some shelves that are emptied, not for lack of food. Deliveries still happen, and the government actually say that there was no food shortage, but people are scared about being confined at home, and they do pack on food for fear of missing out. So a very tense situation right now, not only in the German capital, but also throughout the country and throughout Europe.
Now, Germany is considered to have done a lot better than its neighbors in managing COVID-19. What would you say has been more successful? Is it mass testing or stricter lockdown measures?
Well, the lockdown measures came a bit later than those taken in Italy, in Spain, or in France, for example, so I wouldn't say so. However, there has been a massive amount of testing here. More than 12,000 tests are being carried each day here in Germany, and by testing early, then one is able to isolate critical cases, people who are contagious, and that shelters people who are at risk of developing an acute form of the virus. So perhaps that has helped. However, the pandemic still continues, and it hasn't reached its paroxysm here in Germany. So it will be a matter of weeks until we can really assess what really worked for Germany that might not have worked elsewhere.
Now, you've talked about the fact that the hospitals are not worried about capacity. They have beds. But how about medical supplies, PPEs, test kits, masks, even respirators? What is the situation across Germany?
Well, when hospitals say they are not worried, it's because they are not worried right now. Now, we cannot say that that won't be the case a bit later, in a week's time, let's say, if cases continue to increase the way they are. But the more measures are being taken to slow down the spread of the virus, such as social distancing, meaning people staying at home and not meeting each other, the more chances companies that actually manufacture all those respirators, those masks, those disinfectants, sanitizer, the more time those companies have to actually produce the products that might be missing otherwise if people just carried on as normal.
Are you working from home yourself, Emmanuel?
Exactly. This lockdown actually changes the way even us reporters are working. I'm working today. I'm lucky to work from the safety of my own home. That's what you're saying. And that's actually the way most Germans are doing right now. They're adapting. They're working they're doing home office. They're working with their computers. So you communicate with your colleagues through WhatsApp groups or through emails. So it's a new way of communicating and a way that we have to get used to for the weeks to come.
Well, listen, we wish you nothing but the best. Stay safe and let's talk again soon. Emmanuel
Yes,
Chase.
thank you. Stay safe too.
Emmanuel Chase there is the political correspondent with DW.